Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral fully occluding earwax, and this is their left ear, which the patient reported to being the worst of the two. And we're just at the entrance here. The wax is quite soft. I did get some water this morning in the ear while showering. Something that we've tried to avoid the patient from doing in the past because they have developed an ear infection as a result. They were very quick to apologise, and we've removed the outer half of the wax, and I believe I'm going to install some medical grade olive oil spray in a moment. There we go, just to bind this really soft wax together because it's a bit too loose. So I'm just suctioning the excess oil. Now this wax is really impacted against the patient's eardrum, and you will see after I remove the remaining plug that there is a bit of vascularis, so a bit of dilation of the blood vessels and capillaries on the eardrum, and it's fine, it will settle down. And you won't see that in their right ear because although their right ear was heavily blocked, it wasn't compressed and really impacted up against the eardrum. Now guys, you may have noticed that little thumbnail in the bottom left of the screen. I just want to introduce you to my colleague. He's an ENT physician in America, and his name's Jeff LaCour. And I just felt he deserved a shout out. He's been an immense help over the last few weeks and months, and we're going to be hopefully working together in the new year with the Wax Scope when we eventually launch it in the US. And he's just been a mountain and fountain even of knowledge and resource. I set up this new chat forum on LinkedIn. It's meant for professionals who are either audiologists or ENT or GPs and nurses who've got a specialist interest, a speciality in terms of practicing when it comes to the ear. And Jeff LaCour's joined the forum, and he's been amazing. He's really within I think the space of 2 or 3 days, he's provided me with some kind of additional knowledge that I wasn't aware of, which is really going to help me in my practice. So I wanted to give him a shout out. His YouTube channel, I'm going to place the link in the description right at the top. And his company name is Compassio Medical Education. Check it out. There's some great content there. It's not only ears, it's if you've got sinus problems. So being an ENT, of course, an ear, nose and throat specialist, there's some videos there on TMJ, so temporomandibular jaw joint disorder. So it's really fascinating, and he's far better at creating videos than me, guys. So you'll know what I mean when you check it out. It's all very professional, and I've got to take some advice and tips someone in to improve my videos, I think. So left ear's clear. Just going to in a moment move on to the right side. So you can see there's a bit of opaqueness, a bit of the posterior part of the eardrum, sort of 3 o'clock there. It's a bit more opaque, so some scar tissue, so it's, some laryngosclerosis, so you get calcium salt deposits in the middle membrane of the eardrum, which is the fibrous tissue layer. So we call that calcification, typically in response to some form of trauma. This patient is a musician, so they are exposed to loud sounds, and they have been for many, many years. So it could be due to acoustic trauma in the past. So they're right at the ears, a bit more bendier, and the first plug came away with relative ease, and we've got this more medial plug. So this plug seems a bit wet, so the patient hadn't been using any drops. I suspect they also got some water in this ear. It just seems a bit too damp. You can get, of course, wet wax, but this has had a damp appearance about it, so as in water got logged deep in the ear. So again, slight attic retraction. The top part of the ear canal near the eardrum, the bony part there, we call that the scutum, that's been slightly eroded, which has exposed what we call the neck of the hammer bone. You don't normally see that, but when that bone is eroded, you can see the neck of the hammer bone, which extends into the middle ear, so it goes medially, so inside the ear. And there is a bit of peripheral laryngosclerosis, so some calcification, buildup of calcium salt deposits. So I'm just mopping up near the entrance here. So guys, yeah, any audio professionals or medical, clinical specialists with an interest in ears, please check us out on LinkedIn. It's Audiology Forum. There's a different names there of similar groups, Audiology Forum UK and International Audiology Forum. We're just Audiology Forum. I created the group name and then I realised later there's some similar names, and we've already got up to 500 members in the space of a couple of days. Well, take care, guys. Speak soon and keep well. Bye.